Hello and welcome. Today we're diving into a common yet often misunderstood condition, overactive bladder, or OAB. We'll explore what it is, what causes it, how it's diagnosed, and the ways we can manage and treat this condition to improve your quality of life. So what exactly causes overactive bladder? The exact cause isn't always clear, but several factors can contribute. These include nerve damage from conditions like stroke, multiple sclerosis, or diabetes, which can disrupt the signals between the brain and bladder. Bladder muscle abnormalities, such as involuntary contractions, can also play a role. Certain medications, excessive caffeine or alcohol intake, and urinary tract infections can irritate the bladder and worsen symptoms. In some cases, the cause remains unknown. We call that idiopathic OAB. Now let's look at the pathophysiology of OAB. Essentially, the bladder is a muscular sac that stores urine. Normally, it fills gradually, sending signals to the brain when it's nearing capacity. The brain then tells the bladder to hold on until you're ready to urinate. With OAB, these signals become erratic or exaggerated. The bladder muscles contract involuntarily, even when the bladder isn't full, creating a sudden and intense urge to urinate. This urgent need can lead to frequent urination, both during the day and night. Overactive bladder is surprisingly common. It affects millions of people worldwide, across all age groups, although it becomes more prevalent as we get older. Women are slightly more likely to experience OAB than men. Because many people are embarrassed to talk about their symptoms, the true prevalence may be even higher than reported. Studies show that it significantly impacts daily life, affecting work, social activities, and sleep. The hallmark symptom of overactive bladder is a sudden, compelling urge to urinate that's difficult to control. This urge is often accompanied by frequent urination, typically 8 or more times in a 24-hour period. Nocturia, or waking up 2 or more times during the night to urinate, is another common symptom. In some cases, OA can lead to urge incontinence, which is the involuntary leakage of urine following the urgent need to go. Diagnosing overactive bladder typically involves a thorough medical history and physical exam. Your doctor will likely ask about your symptoms, how often you urinate, and any other relevant medical conditions. A urine test can rule out urinary tract infections or other underlying causes. A bladder diary, where you record your fluid intake and urination patterns, can provide valuable information. In some cases, more specialized tests, like urodynamic testing, may be performed to assess bladder function and rule out other conditions. While OAB doesn't have distinct types in the traditional sense, it's often categorized based on the presence or absence of urge incontinence. If you experience the urgent need to urinate and involuntary leakage, it's considered wet overactive bladder. If you experience the urgency and frequency without leakage, it's considered dry overactive bladder. Both variations share the same underlying cause of the involuntary bladder muscle contractions. Managing overactive bladder involves a multifaceted approach. Lifestyle modifications are often the first line of defense. These include bladder training exercises to increase bladder capacity and control, pelvic floor muscle exercises, Kegels to strengthen the muscles that support the bladder, and dietary changes to avoid bladder irritants like caffeine and alcohol. If lifestyle changes aren't enough, medications such as antimuscarinics or beta-3 agonists can help relax the bladder muscles and reduce urgency. In more severe cases, advanced therapies like Botox injections into the bladder muscle or sacral nerve stimulation may be considered. While not always preventable, certain lifestyle choices can reduce the risk or severity of overactive bladder. Maintaining a healthy weight can reduce pressure on the bladder. Regular exercise can strengthen pelvic floor muscles. Limiting caffeine and alcohol intake can minimize bladder irritation, and treating underlying conditions like diabetes can help prevent nerve damage that contributes to OAB. The prognosis for overactive bladder is generally good. While OAB can be a chronic condition, it's often manageable with the right combination of treatments and lifestyle adjustments. Recent research is focusing on developing new and more targeted medications with fewer side effects. Studies are also exploring the role of the gut microbiome in bladder health and potential therapies that target the gut-bladder axis. With continued research and improved treatment options, living a full and active life with overactive bladder is entirely possible.